Thank you everyone for coming today. I want to discuss the awareness of breast cancer. When a woman or a loved one is aware of the history of breast cancer, the signs and symptoms, and the risk of cancer, it helps her to seek the appropriate medical diagnostic testing. It is safe to assume that at least one of you here in this room has been touched or knows someone that has been battling breast cancer. First, I want to talk about the history of breast cancer. But in order to do that, I have to first define what cancer is. Our bodies are made up of tiny cells that are normally made to reproduce or regrow to replace the old ones. This is what cells look like. This is a process that is regulated through a gene. Over the course of time, the regrowth of the cell can either become mutated, and if this mutated cell is reproduced out of control, it forms what we know to be a tumor. A tumor can either be benign, meaning that it's non-cancerous and not harmful to the body, or it can be malignant, meaning that it's cancerous and can harm our bodies. Breast cancer is defined as a malignant tumor that has formed a cell of the breast. There is many areas of the cell that can develop the cancer. As shown here in this picture, and you all have a sample of it, it can start here under section B, which is the lobules, or under section A, which is the ducts, which is the area that drains the milk from the lobules to the nipple. Very rarely, but sometimes, it can happen here in the fatty tissue of the breast. If the breast cancer reaches the lymph nodes, which are located near the underarms of the body, it has the capability of spreading throughout our entire body and our organs, just shown here in this picture. The green here demonstrating that it carries throughout the entire body. Next, I want to talk about some of the signs and symptoms of breast cancer that we can either feel or notice either in our breast or our nipples. The nipple may feel tender or have a lumpy thickening that can be in the breast, near the breast, or even close to the armpit. The skin texture is often described to feel like an orange peel. Or we can palpitate a lump. Changes in the size or in the shape of the breast, they're either swelling or shrinkage. The nipples can either be inverted or inward. And if the skin of the breast, the areola, or the nipple are reddened or swollen, just like shown here in this picture, and this spot here demonstrating a lump. It's also important to notice if there's any discharge to the breast if you're not breastfeeding. It is estimated that 1 out of 8 women born in the United States have a chance of being diagnosed with breast cancer at some point in their lives. Once a woman reaches over the age of 50, she has a 2.38% chance of developing breast cancer over the next 10 years. As for someone that's 30 years old, they have 0.44% chance of developing breast cancer over the next 10 years. And finally, I want to talk about some of the risks of breast cancer. According to the CDC, there are some factors that increase the risk of breast cancer. The first one being the age. You can have a family history on either a mother or father's side. You can have radiation therapy that can either be to the breast or the chest. If you drink alcohol, if there's hormone replacement therapy, or if there's density to the breast. I also want to mention DES drugs. DES drugs were drugs that were given to women between the age of between 1940 to 1970 in hopes of causing a healthy pregnancy and preventing miscarriages. Now they're finding millions of women that were exposed to these drugs are now being diagnosed with some form of cancer. I want to thank you all for your time and hope that this information, the history, the signs and symptoms, and the risk of breast cancer can be beneficial to your lives and help you seek the proper medical diagnosis.